All right, let's move on to patient consumer verification. How do you know if somebody qualifies for the use of cannabis? It gets a little bit tricky, and there's actually not really a way that we can deny someone, but we'll talk about some of those things. So Health Canada has committed to keeping a medical track for cannabis use. It's actually really important for a lot of people who are using cannabis, especially for quite complex medical situations. We're starting to understand that there's contraindications in use with different drugs, and some people react really quite negatively to cannabis use. So having some medical supervision is important here. The Health Canada statement on it at this point in time in 2020, we are committed to keeping a distinct system for giving patients reasonable access to cannabis for medical purposes. Cannabis for medical purposes will be continue to be legal if you are authorized by a healthcare practitioner, registered with a licensed seller or with Health Canada. And the courts in Canada have ruled that the federal government must provide reasonable access to a legal source of marijuana for medical purposes. So those are all Health Canada statements that are online. One other one, cannabis is not an approved therapeutic product, and provision of this information should not be interpreted as an endorsement of the use of cannabis for therapeutic purposes or for marijuana generally by Health Canada. So Health Canada has created this medical stream, but they're also kind of covering their butts by saying like, hey, we don't really approve it as a therapeutic product, but we understand that people want access to it, so here's the information that we have, and we've created this safe stream for you to get cannabis through legal means. And then be able to have access to advice from healthcare practitioners as well. So it's such an interesting system that we have here in Canada because it is a very interesting and unique product that can be used both recreationally and medically. So we'll push our way through all of this stuff and see if we can come up with some concrete answers. But right now, there's still a lot of, it's at the discretion of healthcare providers. So we'll talk about a lot of that as we go through. Let's take a look. How do you get legal access to medical cannabis in Canada? Well, there's three ways. Licensed producers, so we'll talk about how to do that. Personal production, that means you can grow your own, or you can designate someone to grow the product for you. So three kind of tracks where you can access legal medical cannabis in Canada. But there's 4 tracks actually. So there's that extra track of being able to have as a just general consumer within Canada, not necessarily medical. So we already talked about purchasing directly from a licensed producer after you have obtained a authorization from a healthcare professional. So that is a medical route. You can purchase regulated products from an authorized cannabis retail store. That would be a non-medical product or a non-medical route of getting your product. You can grow your own, and that is both medically and non-medical. So you can, every Canadian of age within their province can grow 4 cannabis plants. Well, that is 4 cannabis plants per household, not per person. And if you're in the medical route, you can apply to have a license to grow your own, and the amounts that you can grow are a lot bigger. So it's going to depend on what your authorization is from the doctor, and we're going to talk about all that. You can also designate someone to grow the product for you, and that would be part of the medical stream. So if you're just a retail grower, you can't ask your buddy to grow your 4 plants for you because that would be more than 4 plants per household. So it gets a little bit tricky, but we do have these 2 tracks in Canada. So 3 ways to get cannabis medically and 4 ways to get cannabis if you include a non-medical route in Canada. How can you verify if a patient qualifies for medical cannabis in Canada? It's a weird question because there isn't any cut and dry rules around it. There's no legalities with the exception of age. So anyone of age within their province can legally purchase cannabis at a regulated store in Canada. So a retail store can refuse to sell a product to a customer that comes in if they appear to be intoxicated, if they can't produce proper ID proving their age, that they are of age in the province that they're in, and if they cause a disruption in a store, they can also be denied sold product. So similar to what you would find at any store in Canada that sells liquor, there are some rules that the retail workers can't actually serve someone who is impaired, and that applies for both liquor and for cannabis use as well. Again, that's at the discretion of the person serving them, the retail worker. There's no way for a retail worker to do any kind of a sobriety test or anything on a customer. As a cannabis educator, you can advise against cannabis use if you feel the patient has addiction issues or maybe some history with mental health. In those cases, it's always really important to refer the patient or the client to a medical professional, because if they get denied by the medical system, they can still just go down the street to a store and buy some products. So it's a better way to have them under some sort of supervision. Plus, as an educator, you're sort of covering your own liability there by saying, like, I'm willing to work with you, but let's get you cleared by a medical professional first. So it is always important that as an educator, if that's the route that you go, that you do have some trusted cannabis educated doctors that you can refer your clients to, and then be willing to work in conjunction with the healthcare professional to make sure that your patient or your client is getting the best care possible. A medical doctor can refuse to authorize cannabis for medical use to a patient at their discretion. So there's no hard and fast rules that Health Canada has said, with the exception of age, that says you can't authorize medical use of cannabis to a patient if they have this or if they experience that. That just does not exist. So it is up to the medical professional's discretion whether they are willing to work with that person using a marijuana product. Some of the doctors will use some standardized tests that are used in the medical field. There's the drug abuse screening test, the DAST, and that's looking for either current or past addiction issues, that not necessarily addiction with cannabis, but Health Canada does sort of give the guidelines if someone has any sort of a history of current or past addiction to other products such as alcohol or opiates or other kind of street drugs, then they do advise that they don't want people using cannabis. So they use the DAST test, or the drug abuse screen test, and then they also have another one which is more of a mental health screening test, which is called the PHQ-9. PHQ just stands for Patient Health Questionnaire, and there's a few of those there. This particular one is just helps screen for depression, and again, doctors will use this to decide if this patient does sort of meet some general guidelines for safe use of cannabis. The most common reasons that a medical doctor or healthcare professional may refuse to provide an authorization to a doctor would be if they are self-reporting suicidal thoughts, and that might come out on that PHQ-9 test, or if they're in some sort of an active addiction to opiates or alcohol or something like that. The interesting thing here is that there is some emerging evidence that cannabis can actually help with withdrawal symptoms from different types of addiction. So instead of it, it was always vilified as the gateway drug back during Prohibition, but there's some evidence starting to come out now that it actually might be the getaway drug and actually helping people break addictions. But right now in 2020, we're still in this place where doctors and medical healthcare professionals are being very cautious about that. There are starting to be some addiction specialists that are starting to create not necessarily guidelines yet, but doing some studies in how can we safely use cannabis to help with someone in a detox program. But at this point in time, there's not really anything that you can, there's no clinic that you can go to and say, hey, I want to use cannabis to help me get off the addictions. There may be some unadvertised medical healthcare professionals out there that are doing that, but right now everyone's being quite cautious about it. So age restrictions for most of Canada, it's 19 years. So most of the provinces and territories, it's 19 years. Usually each province is the same as for alcohol. Alberta is the outlier at 18 years, and Quebec is another outlier at 21 years of age. So the age restriction that Health Canada has set is that a adult in Canada has to be at least 18 years old, and then the provinces can impose further restrictions on that. So Quebec has kind of taken that to 21 years, but most other provinces are at 19, and that's generally in line with access, how Canadian adults can access alcohol across the provinces and territories as well. So age restrictions do apply to both medical and retail cannabis users. Now, there are some exceptions. They're not official exceptions that are endorsed by Health Canada for using cannabis with youth. It would be, again, at the discretion of the healthcare professional. And again, that's a super tricky area. There is, I don't know of any doctors right now that are advertising that. There may be some out there. But again, it's a really sensitive area that healthcare professionals may not be willing to publicly put themselves out on the line and saying like, hey, I can help use medical cannabis for your child, your underage child. So that may change in a few years as we get more evidence and the general public and healthcare providers, as well as the medical system and law enforcement, get more comfortable with cannabis use and its safety issues. But at this point in time, it's pretty difficult to sort of break those age barriers right now. So Health Canada guidelines for when cannabis should not be used. So these are just guidelines. These are not hard, fast rules. The healthcare professional who is providing authorization for cannabis use absolutely can use their own discretion, but these are some of the guidelines that Health Canada has published on their website. First of all, Health Canada says shouldn't be used by anyone under the age of 25. Now, this is referring to the psychoactive component of cannabis, which is THC, that potential for impairment. Why age 25? It's the sort of this general thought that the human brain doesn't fully develop until we're in our mid-20s. And there have been cases of teenagers or young adults who have taken high potency THC products and had psychotic breaks from that, or had serious mental illness that can be directly related to using high potency cannabis products. Again, we don't really understand who's at risk for this and who's not at risk for it. So Health Canada is basically saying, hey, if you're under 25, don't use high potency THC products. Again, those rules aren't necessarily followed. An 18-year-old can go and buy a high concentrated legal product in a cannabis store without any legal restrictions on them. So again, we got a lot to work out here. We've got a few things to sort of still figure out as we kind of forge on this path of a country that no country has done this before. So Health Canada just also advises that if you're allergic to cannabinoids or smoke of any kind, and obviously that would be if someone is going to be smoking the cannabis product. And of course, we know that there are many other ways that we can use cannabis besides smoking. If someone has a serious liver, kidney, heart, or lung disease, there's a couple of studies for each of these diseases that have very few participants in them, and we don't know if these studies, well, we'd have to go into each of these studies to find out if they were using an actual cannabis product from the plant or if they were using highly concentrated synthetic cannabinoids during these studies. So again, there's a lot of misinformation out there, or a lot of outdated information out there in the studies. So Health Canada has kind of just made this broad statement to say, hey, if you have serious liver, kidney, heart, or lung disease, you should probably stay away from cannabis. Definitely people who do have these diseases should be working with a medical professional and then using the educator just to help with product choice in following the guidelines of the medical professional. If they have a personal or family history of a serious mental health disorder such as schizophrenia, psychosis, depression, or bipolar, some of the evidence that is starting to come out is suggesting that if there is a personal history of these mental health disorders and or a family history of these mental health disorders, then someone may be at higher risk of developing this or having some serious side effects from cannabis. But again, this is quite rare and we don't really understand who's at risk yet. There hasn't been enough studies to understand it. But there has been some slight trends in families with mental health disorders. So erring on the side of caution, we always want to stay away from THC products if this is an issue. Of course, when pregnant or planning to get pregnant or breastfeeding, we just don't have enough studies on that. There's lots of tried and true safe products that a woman can use, especially in the early first few weeks and months of pregnancy. If nausea and vomiting is an issue, we have lots of great safe herbal products that have been used for a long time that can be done. And again, we just don't know what cannabis products do to a developing fetus. So we have to, be very careful to recommend against that if a woman is pregnant, breastfeeding, or even thinking about getting pregnant. Health Canada always also says if a man wishes to start a family. So there has been some studies to show that cannabis use, especially higher THC, chronic cannabis use, can cause a sperm count, lower sperm count, or low mobility of sperm. And we see that same kind of study that comes out, or the same kind of warning that comes out with cigarette smoke. So again, we have to go dig out every single one of these studies and say, was this based on men smoking cannabis? So was that due to the cannabis smoke, or is there actually an issue where the cannabis or the THC actually is affecting the health of male fertility? So again, so much we don't know yet. Have a history of alcohol, drug abuse, or substance dependence. So again, we're looking at current or past history of addiction, and Health Canada is saying that cannabis is an addictive plant as well. Some of the stats that are coming out now is the amount of people, or the percentage of people who start using cannabis on a regular basis. The addiction rate is somewhere around 9 to 11%. And then the addiction to cannabis can be, it's not life-threatening the way the addiction to some of the other drugs or alcohol can actually kill you if you overdose, where an overdose of cannabis will just put you into a really uncomfortable state for several hours or even a few days. So, but again, as an educator, we have to err on the side of caution and always involve healthcare professionals that have access to more information or understand sort of contraindications in drug use and cannabis use, because we don't know what all those contraindications are yet. So there may be other conditions where this product should not be used, but which are unknown due to the limited scientific information. Again, that's Health Canada just sort of putting out a broad statement there saying like, hey, if you want to use this, we don't know everything that we need to know about this product, so use at your own risk.